Hello everyone, welcome to my another video. Today we discuss about a special MCQ on anemia. This is part 2. For more important MCQ on nursing subjects, make sure you subscribe to this channel. Question number 11. Schilling test is used for option A. Storage of vitamin B12, B. Production of vitamin B12, C. Digestion of vitamin B1, D. Absorption of vitamin B12. Right answer is option D. Absorption of vitamin B12. Schilling test is a test that uses oral radioactive vitamin B12, that is cyanocobalamin, and injected non-radioactive vitamin B12 to assess the gastrointestinal absorption of the vitamin. It used primarily to diagnose pernicious anemia. Next question. What care would the nurse provide for the patient undergoing a Schilling test? Option A. Provide bed rest. B. Monitor vital signs. C. Collect 24 hours urine specimen. D. Maintain pressure dressing. Right answer is option C. Collect 24 hours urine specimen. A person with normal cyanocobalamin absorption excludes 8% to 40% of radio level vitamin B12 in a 24-hour urine collection taken after the injection. Next question. The condition directly related to bone marrow suppression is option A. Pernicious anemia, B. Sickle cell anemia, C. Aplastic anemia, D. Megaloblastic anemia. Right answer is option C. Aplastic anemia. Aplastic anemia is a type of anemia caused by deficient red cell production due to bone marrow disorders or suppression. Next question. In which of the following disorders an abnormal hemoglobin leads to chronic hemolytic anemia with other clinical manifestations due to point mutation of DNA? Option A. Thalassemia, B. Hemophilia, C. Hemoglobinopathy, D. Sickle cell anemia. Right answer is option D. Sickle cell anemia. Point mutation means change in only one nucleotide in the DNA sequence of a gene. Sickle cell anemia is also a point mutation inherited disorder in which an abnormal globin protein chain forms only due to single substitution of glutamic acid to valine at position of 6 of beta chain of globin protein in hemoglobin. Next question. Which of the following is not a precipitating factor related to pain crisis in the child with sickle cell anemia? Option A. Stress, B. Trauma, C. Infection, D. Fluid overload. Right answer is option D. Fluid overload. Sickle cell crisis or vaso-occlusive crisis in sickle cell disease is painful occlusions of blood vessels in bones, chest, lungs or abdomen with resulting in infarction of tissue. The conditions which increase the demand of oxygen like dehydration, fever and emotion will precipitate the situation because in deficient oxygen supply, the RBC becomes sickle shape, which leads to occludes blood vessels. Next question. An 8-year-old child is admitted to the hospital in sickle cell crisis. Appropriate nursing action during this period includes option A. Administration of oxygen, B. Cold compress to painful joints, C. Restricted fluids until crisis over, D. Active range of motion exercises to all joints. Right answer is option A. Administration of oxygen. During sickle cell crisis, the most appropriate nursing action during this period is administration of oxygen. Next question. Definitive diagnosis of aplastic anemia into children is option A. Decreased hemoglobin, B. Decreased level of hematocrit, C. Increased size of RBC, D. Bone marrow aspiration. Right answer is option D. Bone marrow aspiration. If bone marrow aspiration shows conversion of red bone marrow to fatty bone marrow, it is a definitive diagnosis of aplastic anemia. Decreased hemoglobin and hematocrit occur in every type of anemia and not specific to any type. In aplastic anemia, size of RBC is normal. Next question. Decreased number of erythrocytes, leukocytes and platelets are indicative of option A. Pernicious anemia, B. Aplastic anemia, C. Sickle cell anemia, D. Polycythemia. Right answer is aplastic anemia. Aplastic anemia means pancytopenia, that is decrease in all cellular elements of the blood, for example platelets, leukocytes and erythrocytes. Next question. Acquired aplastic anemia usually manifests with all except option A. Purpura, B. Oral ulcers, C. Hepatosplenomegaly, D. Fatigue. Right answer is option C. Hepatosplenomegaly. Acquired aplastic anemia usually manifests with purpura, oral ulcers, and fatigue, etc., but not hepatosplenomegaly. Next question. Sequestration crisis is related to option A. Pernicious anemia, B. Sickle cell anemia, C. Aplastic anemia, D. Iron deficiency anemia. Right answer is option B. Sickle cell anemia. This occurs when an excessive amount of blood becomes trapped in the spleen, causing a dangerous drop in the circulatory blood volume. So this is the today's video. Thank you so much for watching my video.